Hey, good morning, everyone. It's Dr. Morales back at it again for my weekly series of plastic surgery questions. So the question is why do some surgeons use drains for tummy tuck and some don't? The answer is, I don't know. Some surgeons they use drains, some don't. I personally use drains for a tummy tuck, and these are my reasons why I use a drain for a tummy tuck. And the reasons is that typically, I would say if not always, I do liposuction on the waistline and with the tummy tuck at the same time. That swelling of liposuction is very inflammatory. You create a lot of swelling. That fluid has to go somewhere. And so even with garments, that fluid gets kind of stuck in your body and it will collect. And so that fluid, I prefer to have it come out in a controlled fashion. And that's what a drain is. And it's a very, 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 very small drain. It's about the size of a Q-tip. It's very soft, it's very flexible, and it's right below the incision line of the Mons area. And so that drain stays there only for a week, and it's a controlled fashion for the extra swelling to come out in a controlled fashion, so you don't get fluid accumulations of the abdomen. So what happens when you get fluid accumulation in the abdomen? What happens is you get these fluid accumulations, they're called seromas, and seromas have to be drained. That means getting stuck multiple times in your abdomen with a big needle to get these fluid collections out. So I've never experienced a seroma of a tummy tuck. I just haven't. I've used drains since I've come out into practice and I haven't had one yet. I think they serve a necessary functional purpose. And I've had better outcomes in my experience. So I don't like poking holes in people with a needle. It's not comfortable. There are surgeons that are doing this, drainless tummy tuck thing, and the general concept of it is they use sutures to close off the space of a tummy tuck. We lift the skin up and we advance and we secure it down. Well, they do extra securing, so they close off the space like quilting. You quilt like the space down. So what happens? So you can't get these. The theory is you don't get these fluid accumulations because everything's kind of being quilted down. One of the downsides, it takes longer to do those techniques. It takes longer to kind of make those suturings done. Does it prevent seromas? Absolutely not. No, it does not. Don't believe it, because it does not. I've seen seromas with these drainless tummy tucks. I've seen seromas had to be drained multiple times within my practice who've had these, drainless tummy tucks. It happens. And that's why I don't do it. So I use a drain. Everyone gets it out in a week, and I think my patients have a smoother and faster recovery because of it, and they're more comfortable. So if you're deathly scared of a drain, I'm here to tell you that it's not as bad as you think. You won't like it. That's the truth. You won't like it, but it serves a purpose, and the purpose of it is to reduce the chance of having a seroma, reduce the risk of having to have it drained multiple times in your recovery. That's just not fun. So just bear with me. The idea is to get you back into full life and recover as quickly as possible. So great question. Hope you learned something. And again, thank you for following.